Okay, my buddy, this blog is for you, and in this one we'll be discussing just a couple of quick tips for CT, so please get your pen and paper out and be ready to write down. Most importantly, just be ready to listen, and then just keep this in mind for next time when you go in and do your CTs of why you're actually doing them. And the first one that I'm going to be talking about is CT abdomen pelvis without IV contrast, and why you would choose to do CT without IV contrast as opposed to with. Really, the only reason, or one of the main reasons you would do without IV contrast is to rule out a kidney stone. The reason you would do this without contrast is because if you use IV with contrast, the contrast will hide the stone, or it will make it so that you can't see the stone because they appear to be the exact same color, which is white. They'll show up as white on your scan. So if the contrast is white and the stone is white, you're not going to be able to see the stone. You might say, well, you will notice it because there's an occlusion, and you'll have contrast going in one ureter versus contrast going in the other one. And this is true to a certain extent. If the stone is small enough to where urine is passing through, you will still have contrast going in through the ureter, so that won't hold true. So again, the main reason is because you don't want to hide the stone with the contrast. So that would be one of the reasons why you would do without, mainly, that I can think about. Another reason would be the BUN or creatinine, more importantly creatinine and GFR, which is glomerular filtration rate, is not within normal limits. And so again, one thing that you do have to assess before injecting contrast is kidney function within normal limits. So make sure you check your lab work before you do anything. If the creatinine is elevated, the GFR is not what it should be, you do not want to inject contrast. So again, that would be a reason why you don't want to inject contrast. So a couple of things to keep in mind when you're doing your history. Do they have a history of kidney stones? Is there any hematuria? Are they having flank pain? And which side are they having flank pain? If it's a female and they are having hematuria, one thing that you would have to ask is, are they on their period? Because if they're on their period, you could get a false positive there. Okay, and the other question would be, is their kidney function within normal limits? Another reason would be maybe they're allergic to IV dye. If that is the case, you do not want to inject IV contrast because then you'll run into some other problems there. So keep in mind, why are you doing it without? And make sure you write a note so that the physician knows allergic to contrast, BUN creatinine not within normal limits, such and such. That way they know why you didn't do it without, why you did it without IV contrast and not with. Now, why would you do it with contrast? And typically most of your studies you're going to do with contrast for this reason alone. If you remember your physiology, anytime that there is any type of tumor, there's going to be new vascularization to that area. So contrast is going to go to that area, and it will be highlighted, which is why you want to use IV contrast. The other reason is if there is inflammation, again, there will be increased circulation to that area. Therefore, that area will appear brighter. So again, that is why you would use IV contrast. If you do something like CT abdomen to check for pancreatitis, you want to use IV contrast because, again, there's going to be inflammation, and if there is inflammation, there's going to be larger number of blood going to that area because of the inflammation. Now, with something like CT abdomen for pancreatitis, the other thing that you're going to be doing is you're going to be injecting you're going to be having them drink oral contrast. And the reason you have them drink oral contrast is because sometimes the stomach can block the pancreas, because if you remember your anatomy, they lie in close proximity to one another, and so the oral contrast will be in the stomach, and it will make it easier to discern where the pancreas, where the head of the pancreas and the stomach are, and this will make it easier for the radiologist to see, to distinguish. but you will also inject IV contrast. So in this manner, you will use both oral and IV contrast. Now, again, remember that for pancreatitis, it lies next to the stomach, so you're not going to be giving them oral contrast and then waiting 2 hours. If you wait 2 hours, the oral contrast is most likely out of the stomach. So your timing is important in this scenario. So anywhere between 10 to 20, 30 minutes after you give oral contrast, give them 30 minutes, and then right before you scan. By the time you've done your scouts, it might have been 5 minutes, so it should be right in the stomach at that time. And this will make it easier again to discern. Now, when you go back and set your recons, you want to make it so that your field of interest is smaller in that pancreatic region. And again, what you're doing is you're magnifying the pancreas so it's easier to see. Okay? So just a couple of tips. Again, if you're ever going to be injecting contrast, always check your BUN and creatinine. If you're injecting contrast because they're suspecting inflammation, such as in appendicitis, diverticulitis, what else? Maybe gallbladder stone, pancreatitis, any of those, check your lab values. Appendicitis, what's your WBC? Diverticulitis, again, what's your WBC? Pancreatitis, what's your WBC? What are your liver enzymes? What are your pancreatic enzymes? Check those. Have those ready for the doctor. Okay, so get used to always checking your lab work. And if you are going to be injecting contrast, again, always ask if they are allergic to contrast, if they have had any diabetic medications recently, if they are diabetic. All right, hopefully this helps out. Again, if you have any questions, please write down, and then that way I can get back to you. Next time we can talk about things like head CT, when to do with, when to do without, chest abdomen, chest, why you would do with, why you would do without. In any case, please write down specifically what I need to be focusing on so that I can give you better information. Okay, see ya.